Atypicals did not come till the mid-90s. And so over time we noticed that perhaps some of the patients who were treatment refractory to this generation, the first generation drugs, may actually respond to some of the atypicals, and there may be a different group of patients who become treatment refractory to the atypicals, although there's overlap. But that was observed in many cases, that maybe a trial of one of the atypicals might do for some patients before we go to clozapine. But by the time clozapine came out, it was used for everybody because that was the only generation at the time. So when the atypicals came, some of them helped patients who were treatment resistant to the older generation, some of them did not, of course, and that's why clozapine was eventually approved for everybody, treatment resistant, treatment refractory, and those with suicidal urges, as I said. Has nothing to do with the refractoriness, but I just wanted to show all the indications for clozapine. Now I'm going to give you some definitions, operating definitions for what is treatment resistance and what is treatment refractory. Here's one. First, we have to talk about an adequate trial. Because when we say somebody is treatment resistant or refractory, we're saying that they did not respond to 2, 3, or 4 adequate trials of first-line agents. Now, what's an adequate trial? This is the simplest one that you can have. Highest tolerated dose, which may be above the FDA-approved dose. It's a little off-label, but we all do it. And then, as long as the patient is tolerating the drug, we push it in case they don't respond. And this should be at least 12 to 16 weeks. So 3 to 4 months trial, monotherapy on a drug at the highest possible doses defines an adequate trial. And believe me, I have, over the years, noticed that very few patients get this. People switch very quickly within 3-4 weeks. Oh, let me go to another drug. They never wait for an adequate trial, which means that patients may eventually either respond to another drug if they're lucky, or they are called treatment refractory or resistant inappropriate. Another definition: treatment resistant or refractoriness refers mainly to the positive symptoms, delusions, hallucinations. Those are the symptoms that call on clozapine. Not, as I said, we have not used negative and cognitive symptoms to justify clozapine. And frankly, clozapine doesn't work in those either. There was a time when we thought it does. It does not. It avoids the secondary negative and secondary cognitive, which I'm coming to in a minute. Those are red herrings that you shouldn't use to diagnose a patient as refractory. What's treatment-resistant schizophrenia? This is not refractory, this is resistant. So it's a modest improvement in the positive symptoms, despite several adequate trials. So the patient still hears voices, not as frequently, not as prominently, not as intensively, but they still hear voices. They're not extremely paranoid, but they're still suspicious. They still have ideas of reference. Not severe enough. So they're not doing well yet. Our goal is to eliminate the symptoms, and it's not going away. Treatment refractory schizophrenia, not treatment resistant, is persistence of severe delusions and severe hallucinations despite the adequate trial. So it's a severity dimension, resistance versus refractoriness. So technically speaking, the primary negative symptoms and primary cognitive deficits of schizophrenia have always been refractory, and we kind of forgot about them because we frankly developed therapeutic nihilism. Can't do anything about it. So let's just talk about the positive symptoms. We can. They're the elephant in the room. The disability of patients with schizophrenia is the elephant in the room, and it's related to the negative and cognitive symptoms. But frankly, the positive symptoms, the psychotic symptoms, are so much more dramatic in your face and can harm other people or the patient. We pay more attention to it. But we should pay attention to all of the symptoms. So, what are the causes of treatment resistance or refractoriness in schizophrenia? There are many potential